Hello, everyone, and I'm so sorry that we can't be with you in person today. My name is Tracy Francis, and I'm a policy and development worker with ARC Scotland. ARC works alongside people who need additional support and their families, and also with people who work with them to make sure that they can live the lives the way that they choose. And I and my colleagues in the Scottish Transitions Forum, which is a part of ARC, we specialise in the transitions these young people make between the ages of 14 and 25 as they move from children's into adult services and on into young adult life. These transitions, you won't need me to tell you, can be very complex for very many young people and their families, and they often involve multiple professionals from different sectors and different backgrounds. And quite often, there may not be a clear pathway that can give families an understanding of who and what's going to be involved and how they can make a particular transition between services or across services. And within health transitions, we often hear young people and families express confusion about who's responsible for what and who they can turn to for information. And very often, the task of making sense of transition falls to the families themselves, often with limited support and with little experience of healthcare structures and competences to help them navigate the way through. And as you'll probably be aware, that can add a huge level of stress and anxiety for families at a time when just the young person's health needs alone are already giving them cause for concern. It's not uncommon for professionals around the young person as well to be a bit unsure about who should be doing what and exactly where they fit into the picture and what their duties might be. So, for all of these concerns, over the past few years, ARC Scotland has been working with young people, with parents and carers and professionals to develop a new digital tool called Compass. So, Compass is an interactive online tool that helps everyone involved in the transition process to have a better understanding of what they need to know and do to make transitions run as smoothly as possible. So, first of all, there are three versions of Compass, and you can see them here. There's a version that's tailored towards the needs of young people, there's a version that's tailored towards parents and carers, and there's a version that's tailored towards professionals. So each one is designed to meet the needs of the user group, but all of them guide the users through what the law says, what national guidelines say, and what good practice in Scotland dictates should be happening around transitions and what people should be able to expect. So for young people, a lot of the emphasis within Compass is on helping them understand what change means for them, what it's going to look like. It also helps them work out what matters to them most and to share their views and their ideas and thoughts with the people that they trust. For the parent and carer tool, what Compass does is provide an overview of the transitions process, and it provides guidance around key topics such as guardianship, finance, and transitions planning. What it does is give both groups links to the best and most up-to-date relevant information that's out there. It's very specific to Scotland. We review the information links that are within Compass regularly, monthly or very close to monthly. And we're revising and we're adding new information all the time. It's very much a work in progress. But just now, I'm going to show you the professional version. And hopefully that will give you a bit of a flavour of the content of the other two tools as well. So when you sign up to the professional version of Compass, you have access to all the same information links that are within the other two tools. So, for example, parents can create an individual timeline that helps them understand where their young person is in the process and what, as a parent, they need to be focusing on at a particular given time. And if you're in conversation with a family, entering the young person's date of birth allows you to see where on the timeline they are and what guidance is most appropriate to be giving that parent at that point. And I think one of the things that I tend to say to professionals is Don't always assume that somebody else will have given that guidance. It may not necessarily be entirely within your remit to give guidance on something like guardianship, for example, but you can still check that the parent or the family involved has had that conversation with someone, because if they haven't, that could be something that would be really important for them. So by flagging up things like that that are really crucial to families at a particular point, it means that you as a professional can maybe operate a little bit more confidently and maybe be a little bit more supportive for the young people and the families that you're actually working with, even if it's something that's not really within your remit. If you go into the resources section by clicking here, you'll see that we've grouped information under topic headings. And so you as a professional can access exactly the same information the parent is being given. So for example, here you can see under legal matters, there's a section on guardianship and powers of attorney. And you can find an explanation of what these are to help work out which is most appropriate for you. And the links at the bottom of that section there take you to sites where you can find more information. The same applies to the Young People's tool. So, for example, under the topic My Health and Care, young people can find useful guidance and information for how they can best be involved in discussions and decisions about their own care and support. However, there's one area in the professional tool that doesn't exist in the other two versions, and that's this one. So here you can find guidance on the duties that apply to various professionals within the process at different stages. All of these duties are legislated for, or they're contained within national guidance that underpins the legal requirements. So we've grouped these duties under must, should, and could. So must are the things that are required by law. Should is something that's expected to be taking place. And could is something that could improve the experience even more once the basic principles and the requirements are being met. So we're hoping that this will go some way towards clarifying the difficulties that some professionals were sharing with us, that they weren't really entirely sure what their duties were and what the remit was, what the limits and boundaries of those duties were. When I created this account, I name myself as a health professional. When you sign up, you say which sector you're working in, and you give your job title. I said that I was an allied health professional working within a health board. It was NHS Lothian actually that I put in. So what's showing up for me here are the duties that are likely to apply to me in relation to transition if the young person's at this particular stage. I can also check what duties apply to other sectors or colleagues in other sectors at this stage as well, just by toggling the wee button here. So hopefully this is something that will actually help people to understand a little bit better, not only what their duties are, but also how that fits into the bigger picture with other professionals and other colleagues, and also gives you a sense and a flavour of what's going on for the young person and for the parents and carers at the same time. The final thing is that it's really important that Compass gives people the chance to give feedback completely anonymously on the transitions experience that they are having. And that applies to you as a professional as much as it does to the young people and to the parents and carers. So it's asking questions like, do you have the information you need? Are things working in national guidelines? Do you have the support to do your job as a professional, or as a parent, do you have the support to be able to work with your young person and alongside the professionals working with them to the best of your ability? So there's similar feedback being collected from the users of the other two tools as well. For reassurance, I said this feedback was completely anonymous, And it is absolutely nothing that anybody puts in here can be linked back to an individual user of the Compass tool. The data controller for the data that's collected through Compass is ARC Scotland. And what this feedback will allow us to do for the first time is to collect data that will nationally measure and evaluate how transitions are working for everyone that's involved. So not just one group of users, not just one group of professionals, but across the piece. It's the bigger picture. And that means that over time, we'll be able to have a much more complete picture of transitions than we've ever been able to have before in Scotland. And a lot of the evidence that it's going to provide are going to be crucial in helping services work out where resources need to be targeted, how commissioning can work to best effect, and how support can be most effective in improving the experiences of young people and families as they go through the process. So ARC Scotland is collating that data. We're doing the number crunching and we're issuing annual reports that are already beginning to highlight what's working well and pinpoint what needs to improve. The second of these annual reports was published in October. And for the first time, we're starting to see that picture emerging of the experiences of everyone who's got a part to play. I'm going to stop there because I think apart from anything else, I've probably used my allotted time, and it's a lot to take in when it's a video that's talking to you and not a real person, unfortunately. But I hope that's been enough to give you a flavour of the work that's going on in this area and maybe some thoughts about how this might be useful to you in your practice, or maybe for the young people and the families that you're supporting and working with. There's still a very long way to go in making Compass as good as it can be. And one of the things that we're doing now is working to make aspects of the tool more directly relevant to healthcare transitions. As I said before, it's a work in progress, and we'd really welcome your thoughts and suggestions for how we can make it better. But in the meantime, please feel free to take a look, sign up, and start using Compass yourself. And hopefully you'll feel comfortable recommending it to families if you think that they would benefit from it, because it's a really important source of information for them that they're not really getting in any other way at the moment. And if there are any questions, or if you'd like to talk it through with someone from ARC, please do get in touch. My email address should be on the screen now, and we'd be more than happy to go over it with you, do a proper demonstration, and just discuss with you. If you've got, as I said, thoughts and suggestions for how we could make it better, we would really love to hear from you. So thank you very much for listening. I hope that's been useful. And hopefully I will hear from you with some feedback. That would be great. It would be lovely to have your thoughts and views. Thank you very much.